Thank you for having me here today. First, I would like to start off by saying that ACT is based on the idea that the psychological suffering is usually caused by running away from difficult private experiences, by becoming entangled in your own thoughts, and as a result of all that, failing to get your feet moving in accord with your chosen core values. ACT is based on new and extensive basic research program on language and cognition, relation frame theory, which explains why pain occurs so readily in people and is so hard to solve. Fortunately, it also suggests new powerful alternatives such as acceptance, mindfulness, values, and committed action. ACT helps people acquire these new skills. They can be learned fairly quickly and they seem to apply to any amazingly wide range of human difficulties. We teach clients how to back up from thought and the world structured by thought and instead to focus on the process of thinking itself. How to feel feelings as feelings, fully and without needless defense, even when we don't like them. How to show up in the present moment as a conscious human being, and how to begin to act in accord with chosen values. In short, we teach people how to be more flexible in moving toward what they really want and less automatic programmed and self-defeating. Research is showing that ACT methods are beneficial for a broad range of clients. There's almost nothing you can mention that doesn't have at least some supportive data on the role of acceptance, mindfulness, and values, or negative data on the impact of avoiding your own experiences and failing to act in accord with your values in that same area. ACT teaches people fairly quickly how to alter their relationship to difficult private experiences and how to get behavior change going now rather than waiting to have difficult emotions or thoughts go away before acting. This empowering message has been shown to help clients cope with a wide variety of clinical problems, including depression, anxiety, stress, burnout, substance abuse, prejudice, smoking, adjusting to chronic disease, and even psychotic symptoms. In the area of anxiety or panic, avoiding your own negative private experiences is one of the strongest predictors of bad outcomes. Conversely, we know from research with a variety of anxiety disorders that when you let go of the struggle with anxiety, you're on the road to a healthier life. This doesn't necessarily mean that anxiety will go away. It means that in its role in your life, you will diminish sometimes quickly. If you think about it, you can see why. Suppose I could tell you if you were the tiniest bit anxious, you could not fool me. And suppose then I held a gun to your head and said, relax completely or I'll shoot. Almost no one would pass such a test. Yet, that is the exact situation a panic disorder person has put themselves into. Instead of being shot, what is threatened is loss of self-esteem or loss of the view that a good life is possible. But that is pretty much the same thing, and the outcomes are equally predictable. We have several studies now showing that ACT can be helpful with anxiety problems. Depression is sometimes spoken of as a feeling, but it's more than that. It's also an agenda, the agenda of not feeling bad. When you are depressed, you are less able or willing to feel, and because of that, you are less able or willing to act. Here is one way to put it. Depression is what you feel when you're not willing to feel something at all. ACT undermines the whole game and instead focuses on what it is that you really, really want in life. While feeling and thinking whatever you feel and think, it turns out that these feelings won't be just depression, but perhaps anger, fear of sadness, or loss, among others. If depression has to go away before a person can move forward, you have an unsolvable problem. But when we learn how to just notice our depressive thoughts and feel our feelings as feelings deliberately and fully, it turns out that we can begin to live again, right now, even with depressed feelings or depressogenic thoughts. And when we do that, we start to move. We're able to contribute to others, to make a difference. That breaks the back of depression. There are 3 small controlled studies on ACT and depression, and it makes a big difference. This work is still young, but so far it appears that ACT may actually be more effective than the best current psychological treatment for depression. We will know when bigger studies are done. In science, that is the key. Replication by others. Chronic pain leads people to spend their lives trying to find a way to get rid of it. But research shows that this approach to pain makes it more central, more dominant, and more disruptive to people's lives. Meanwhile, there is an even bigger tragedy happening, that pain itself, a life is being lost. It turns out that ACT can greatly improve functioning by helping the chronic pain patient focus on his or her own chosen values, and while being aware of the pain when it is present, begin to live again. ACT helps the person with chronic pain step back from the chatter that says he or she can't live until pain goes away, and without arguing back, simply begin to move forward. I personally don't have chronic pain, but I do have tinnitus. My ears are screaming 24/7. And do you know what the literature says? Any attempt to cope with this is harmful. What you need to do is to let go of it and focus on living. I now sometimes go an entire day without noticing tinnitus, even once. But every time I check, wow, is it noisy. Chronic pain is like that. We need to learn to live with it. We're not talking about living with it like putting up with it or tolerating it. We're talking about living with it. It appears that ACT can make a difference in chronic pain. In one study, with people just starting to become chronic pain patients, 4 hours of ACT reduced sick leave due to pain almost to 0 levels. In another patient who have been in pain for over a decade, 3 weeks of ACT improved their functioning 20 to 40%, depending on the area. So we know we can make a difference with chronic pain. Most addictions seem to be in large part driven by avoidance and cognitive entanglement. When you use, you are trying to feel only good. Drugs are sometimes called a fix. Fixing means repairing what is broken, but it also means to hold something in place. Drug and alcohol abusers are trying to hold feeling good in place by chemical means. When you abandon that attempt, you will sometimes feel good and sometimes feel bad. If you can do that and focus instead on changing your behavior, you have a way forward. We now have controlled ACT studies with several kinds of substance abuse, including marijuana and heroin, and they show good effects. ACT has an agenda, sort of like that serenity prayer from AA. Accept what you can't change. Change what you can. In the prayer, clients ask for wisdom to know the difference. ACT theory specifies that difference. It is good to change your behavior. It is harmful to try to change the automatic result of your history. There are now 3 randomized trials of ACT for smoking, and so far it beats the patch, Zyban, and traditional cognitive behavior therapy. What ACT does is it gives people the skills they need to willingly carry the pain that they have and integrate it into a valued life. You need to learn how to back up from your thoughts and see them as they are, to show up in the moment, to commit to your values. That plus exposure will move you ahead. The normal therapist would say the natural, rational thing to do when we face a problem is to figure out how to get rid of it and then actually get rid of it. In the external world, our ability to do just that is what allowed us to take over this planet. But that only works in the world outside our skin. We don't at first realize that, and so we deal with our own psychological struggles by trying to get rid of our painful feelings, difficult memories, or worrisome thoughts, as if then we'll be happy. But it doesn't always work. Thank you. Stephen C. Hayes. ACT Therapy.